Hello and welcome to MediByte. Today we're diving into a really interesting non-hormonal approach to birth control, fertility awareness-based methods. Now, this is a system that relies not on medication, but on something you already have, a deep understanding of your body's own natural cycles. So let's see how it all works.
So, what are we really talking about here? At its heart, this whole approach is about learning to read your body's own signals. Instead of using hormones or physical barriers, it's all about identifying the exact days in your menstrual cycle when pregnancy can happen, and then using that knowledge to prevent it.
All right, here's our game plan for today. We'll kick things off with what these methods are, then get into the science of your fertile window. After that, we'll cover how you can actually track your body's signs, talk about how effective these methods really are, and finally, help you think about whether this approach could be the right fit for you.
Okay, so to really get how these methods work, we have to start with timing. Because, pregnancy is only possible during a very specific window of time. And just how long that window lasts might actually surprise you.
So, what does this timing really look like? It's a common misconception that you can get pregnant any day of your cycle. That's just not true. There's a very specific window, and it's all created by the lifespans of two key players, the sperm and the egg.
First, let's talk about sperm. They're surprisingly resilient. After intercourse, sperm can actually survive inside the female reproductive tract for up to 5 days, just waiting for an egg to be released. This is a really crucial part of the fertility puzzle.
Now, here's where it gets really interesting. Contrast that 5-day lifespan with the egg. Once an egg is released during ovulation, it's only viable for about 12 hours if it isn't fertilized. So when you put it all together, the 5-day sperm can wait before ovulation, plus the half-day the egg is available after ovulation, you get what we call the fertile window. That's the roughly 6-day period each cycle where intercourse could lead to a pregnancy. So if that 6-day window is the key to everything, the big question is, how on earth do you know when it is? Well, that's where the tracking methods come in. And there are 3 main ways to do this. Let's start with the calendar method. This one is all about predicting your fertile window based on your past cycle history. Now, because it's based on patterns, this is really only a good option for women who have super regular menstrual cycles. If your cycles vary a lot, this one's going to be tricky. To even try this, you need a lot of data. We're talking at least a year's worth of tracking your cycles. Then, as you can see, you find your shortest and longest cycles from that year and do a little bit of math. You subtract 18 from your shortest cycle length and 11 from your longest, and that gives you the estimated start and end of your fertile window. As you can probably guess, this takes some serious diligence. Okay, the next method shifts from just predicting to actually observing your body in real time. It's the mucus method, and it's all about watching for physical signs. See, around ovulation, your hormones cause cervical mucus to become clear, slippery, and stretchy, kind of like raw egg whites. That change actually helps sperm travel. So by checking for these changes every day, you can get a live update on when you're in your fertile period. And finally, we've got the symptothermal method. Now, this one is widely considered the most reliable of the bunch, and for good reason. It doesn't just rely on one sign. Instead, it layers multiple observations together, which gives you a much clearer, more accurate picture. So this method is kind of like being a detective. You're combining 3 key clues. First, you track your basal body temperature, which is your body's temperature when you're completely at rest. The key here is that it rises just a little bit after ovulation happens, confirming that the window is closing. Second, you track your cervical mucus, which helps you predict when ovulation is coming. And third, you still use your calendar data for the big picture. So you're not just relying on one sign, you're using clues to predict the window and another to confirm its past. That's what makes it so powerful.
Okay, now for the million-dollar question. How well do these methods actually work? To answer that, we have to talk about 2 really important terms you'll hear in any discussion about contraception: perfect use and typical use.
So perfect use is exactly what it sounds like. It's the effectiveness rate you get when you follow the rules perfectly every single time without making any mistakes. Typical use, on the other hand, is reality. It's how effective the method is for most people, factoring in, human error, like forgetting to track a day or maybe misinterpreting a sign. The gap between those 2 numbers tells you a whole lot about how forgiving a method is. And this chart shows that gap perfectly. Look at these numbers. For the calendar method, the typical use failure rate is more than double the perfect use rate, 12% versus 5%. Same story for the mucus method. But now, look at the symptothermal method. With perfect use, fewer than 1 woman out of 100 will get pregnant in a year.
And even with typical use, it's only 2 out of 100. That is an incredibly high rate of effectiveness.
So, to put that 2% typical use number into perspective, let's compare it to some other common methods. The birth control pill has a typical use pregnancy rate of around 9%, mostly because of things like missed pills. For male condoms, it's about 18%, usually because of inconsistent or incorrect use. This really shows that when used consistently, the symptothermal method can be incredibly effective.
So, with all of this info on the table, how do you decide if a fertility awareness-based method is the right choice for you? Well, it really comes down to weighing the pros and cons and thinking about your own lifestyle, your health, and what you're looking for. Let's break it down. On the one hand, these methods are a serious commitment. We're talking daily diligence that is absolutely non-negotiable. You have to be okay with abstaining from unprotected intercourse for several days each cycle. They're also less reliable if your cycles are irregular. And, this is a huge one, they offer zero protection against STIs. But on the flip side, it's a completely hormone-free option, and a lot of people find that the process gives them an amazing connection to and understanding of their own bodies.
If there is one thing to take away from all this, it's this quote right here. Unlike taking a pill or having an IUD, the effectiveness here is not passive. It is 100% tied to your personal commitment and how precisely you follow the instructions, day in and day out. This is a method that really empowers you with incredible knowledge about your body, but it also places all the responsibility for its success squarely in your hands. So the question you have to ask yourself is, does that fit my life and my goals right now? Look, at the end of the day, this is a decision that's best made with some professional guidance. Your doctor or another trusted healthcare provider can help you weigh all the personal factors and figure out if this is a safe and suitable option for your unique situation. And that's our look at fertility awareness-based methods. Thank you so much for joining us here at MediByte. If you found this helpful, please give us a like, share it with someone who might be interested, and of course, subscribe for more clear health explainers. We'll see you next time.